Capgras delusion is a psychological disorder in which a person holds a delusional belief that someone they know, usually a close family member or friend, has been replaced by an identical impostor. This disorder is named after Joseph Capgras, the French psychiatrist who first described the condition in 1923. The delusion typically involves the visual recognition system, where the affected individual can recognize the face but feels a lack of emotional connection, leading them to conclude that the person is not who they appear to be. The exact causes of Capgras delusion are not well understood, but it is often associated with other neurological conditions, such as schizophrenia, dementia, or brain injuries affecting the temporal lobes or the limbic system. These areas of the brain are crucial for processing facial recognition and emotional responses. Treatment for Capgras delusion generally involves antipsychotic medications, psychotherapy, and management of any underlying neurological or psychiatric conditions. Cognitive behavioral therapy can also be helpful in addressing the delusional beliefs and improving the individual's coping mechanisms. Despite treatment, the delusion can be persistent and may significantly impact the individual's social interactions and personal relationships. Please note that the individuals shown in this video are for illustrative purposes only and may not be actual healthcare professionals or patients. Thank you.